Hello, and welcome back to our video lectures on helping our suicidal friends. Today, we're going to be looking at evaluating risk and protective factors with regards to suicidality. In our previous lecture, we were discussing how to evoke a narrative from our friends to help them explain their suicidal thoughts and their suicidal reasoning. In this particular lecture, what we're focusing on is how to evaluate that information that they are giving us. One of the most common things people think about is to just look for the presence of suicidal thoughts. But suicidal thoughts do not guarantee that suicide will happen. It's estimated that approximately 0.5% of people with suicidal thoughts appear to commit suicide. What we also need to be considering are previous diagnoses, substance abuse, trauma, and other suicides the person may have witnessed. We should indeed be looking for the presence of suicidal thoughts, but we're also wanting to look for their intensity and their duration and their frequency. With regards to frequency, it's as simple as asking if their suicidal thoughts have been happening daily, weekly, or monthly. It should also be noted that an intense desire for death does not automatically correlate with achieving suicide. You want to be able to obtain the reasons for why they want to die. Specifically, ask them if they know what method they would use. Do they happen to own any firearms? Do they actually have the means to carry out the method in mind? How much planning and preparation has gone into their suicide, such as the where, when, and the how? Did they plan to wrap up any last business or write a note to anyone? And have they been looking up any suicide-related information online? We also want to ask them, how likely is it for them to act upon their intent and when? Does the person believe they can control their suicidal urges? And do they also happen to have any homicidal urges? Though granted, having homicidal and suicidal urges is a lot rarer, sometimes the two can go together. We're also trying to see if the person has made any other previous suicide attempts. What was the worst and most intense suicide attempt that they've had? The more common and more intense these previous suicide attempts were, the more likely the person is probably going to attempt again. Even previous attempts at self-harm, such as cutting oneself, can be predictive of increased chances. When we are specifically looking at warning signs and risk factors, we want to put more emphasis on warning signs. Think of risk factors as something analogous to climate, while warning signs are much more analogous to the weather. Warning signs are much more indicative of an emergency brewing. No warning signs should be taken in isolation, and very importantly, suicidal intent should be present. With regards to long-term risk factors, there's a fairly long list. I'll include some of them here, but I will also provide some of them here in the video, available for reading. Some of these include psychiatric illness, substance abuse, prior psychiatric hospitalization, and experiencing trauma. When it comes to warning signs, though, it's also a fairly long list, and I will also provide a list here on screen, but some examples include frequent and intense suicidal thoughts, talking about, writing about, preparing for, and rehearsing their suicide, and having feelings of hopelessness. Now, for a lot of people, there's just a lot of emphasis on what are the signs of suicidality in general, like what should we be looking for before something goes wrong. We don't really tend to think about the protective factors that help people prevent their suicide. But before we really focus on those protective factors, we want to remind ourselves that we need to validate our friends' emotions, and we want to investigate their reasons for dying. We also specifically want to ask the person if they have any reasons to be alive. Who or what motivates them to stick around? Once you have those basics down, from their narratives that they give us, we can look for some of the protective factors that may help offset their suicidality. Some of these factors include hopefulness, feeling optimistic, having social support from friends and family, having problem-solving skills, coping skills, reality testing skills, having positive self-esteem, and much more. You should also be encouraged to ask questions about how one's cultural group and identity influence their views on suicide. This does include asking about religious influences and if the person is consistent with their religious beliefs with regard to suicide. Even if you're not a religious person yourself, it is highly recommended you at least be friendly towards the person and work with their religious beliefs instead of against them, especially because they are in such a dire situation. Once you're aware of both the risk factors, warning signs, and protective factors, it becomes a lot easier to assess the person's risk. Admittedly, this is not going to be easy because such an assessment is definitely subjective and it's never fully predictable what the person is going to do. You should directly ask the person how likely it will be for them to commit suicide and when they're probably going to commit suicide. You need to think about the risk for acute versus chronic suicidality as well. Assume that the protective factors will have very little effect once an acute high-risk situation emerges. The higher the risk is, the more you want to emphasize the use of a suicide safety plan and the removal of any means to cause suicide and self-harm. Now, one of the more difficult things to discuss is when you should recommend hospitalization for your friend. Ideally, you only want to recommend it if it is very clear that the person is experiencing high acute risk. You want the person to ideally agree with you to the hospitalization. Do not force them. Typically, such a scenario arises when it is very clear that the person has a plan and method at the ready to commit suicide, or if the person has committed a recent suicide attempt, or if they hear command hallucinations to tell them to commit suicide. You do not want a person to go to the hospital alone, and it would be pretty ideal to accompany them or to have them go in an ambulance. The person will likely be under care for a week before discharge, and it is heavily recommended to visit them within 24 to 48 hours after discharge. A person can be quite volatile still and likely relapse between 24 hours and a month after their discharge, sometimes even up to a year. This is where social connection becomes extremely important during this period of recovery. Do not attempt to force hospitalization if it is clear that the person is not acting on suicidal thoughts and if they are willing to follow their suicidal safety plan, which we will also discuss in a future video. If you force hospitalization when it is not necessary, you can end up isolating the person and making them feel socially disconnected. And some people may even become dependent on hospitalization as a means to obtain attention, love, and support, which can be especially true for those who have borderline personality disorder. Again, to hammer this home, do not attempt hospitalization just to be better safe than sorry or to alleviate your anxiety. Only do so as necessary as I have outlined.